to do that part. And then I'm going to start streaming if it'll allow me. So welcome everybody to our TBI Talk here today with Dr. Marc Ellis. And Dr. Ellis is a functional neurologist located in the Atlanta area, Georgia. And oh, nice backdrop. It's magic. And so we're thrilled to have him here today to be sharing about, the effects of long COVID and particularly on folks with TBI. I have had a lot of requests for this type of conversation. So I knew Dr. Ellis was the one to reach out to. He does a lot of work with TBI and long COVID patients. So welcome, Dr. Ellis.
Thank you. I appreciate it very much.
So anyone who is here live participating, if you have any specific questions for Dr. Ellis, please put them in the chat, and we will definitely get to those. And then Dr. Ellis, tell us a little bit about your background and working with TBI patients in specific, and then
helping people with concussions very early on in the knowledge base of it. So in the beginning of this millennium, I guess, we were working with concussion patients, and at that time it was kind of interesting because people didn't really know what they were, concussions. So they were looking at it and it was, well, do you have to get knocked out? Do you have to lose consciousness? Do you not have to lose consciousness? What are the tests for it? And one of the big problems we had was there was a test, it was called an impact test. And you would take this cognitive test, and if you didn't have a problem on it, they said, well, you didn't get a concussion. But we were seeing people with vestibular disorders or with emotional problems or with processing themselves in their world and spatial disorientations. And we're going, no, wait a minute, these people are having problems. But they didn't fail the impact test. So as time went on, they started to realize, oh, concussions can affect different parts of the brain. So it could affect your emotional brain, it could affect your visual system, it could affect your balance system, it can affect your inner ear. And then they started to talk about how different concussions can actually be impacting people differently. And I think you've done a lot on working to educate the world of, yeah, you did have a concussion. Your MRI looks normal. You're not having maybe the symptoms that they maybe say you have to have, but you're having these symptoms. And as time's gone on, more and more people have realized that that's happening. Well, when COVID showed up, COVID was really, it was kind of self-evident for me because everybody was talking about these lung problems. And then people were going, I didn't really have COVID that bad. But ever since that time, I've been having all these other problems. And you knew for sure that it was affecting the brain because people were losing smell and taste. So once that happened, they lost smell and taste, but then other things started to happen to people. And for me, I just looked at it and I went, this is like a chemical concussion. You just got exposed to something and it's affecting different people in different ways, and they're getting different symptoms, even though there was a pretty strong trend with it. So what we saw was in the beginning, people were getting loss of smell and taste, and then people were getting the fatigue and the cognitive aspects. Then people started to get vertigo. Then people started to get postural orthostatic tachycardic syndrome. And now it's evolved into a whole nother thing that I think we'll get to as we go along. And so for me, I started with concussions and have done a couple decades of really watching that evolve and training people all around the world and being involved, I think, in a great group in that. And then when COVID hit, it was like, okay, here we go. We were prepared to help those people. And then it turned out that what we thought was actually true. So in what how it
Right.
was affecting the brain.
Yeah, I remember hearing just in general from doctors about the fact that people are losing taste and smell, and that was a clear indicator it was affecting the brain. And so I know a lot of folks with TBI who had COVID and they're still struggling, and people without TBIs too, right? Like, I don't want to say it's only TBI folks, but I feel like people with TBI are already more vulnerable to the effects of long COVID. um when I had COVID, I was fortunate. I did not lose my taste and smell, which I was really surprised. But the fatigue, wow, that hung around for a long time. So anyone who's had any experiences, let us know in the comments if there's anything that you're still struggling with post COVID that you think might be connected. I
And we
remember,
and we
go ahead.
no, go ahead. Nope. Go ahead, Amy.
Oh, I was just gonna say the weird symptom I had, and once I brought it up, I was seeing Dr. Stedman in Colorado at the time, and once I brought it up to him, he's like, "Oh yeah, it's actually been pretty common." My uvula, the dangly thing in the back of your throat, um, that got super inflamed,
Huh.
and it was the oddest. Like, what? But when I Googled it, I found out it was like a sort of common symptom that they were seeing with COVID. And if you've never experienced that, it feels like you're choking every time you swallow. So that was super fun. Um,
Hmm.
and AK just mentioned they have new vestibular issues. Yeah. What were you going to say? Do you remember?
Well, so I think for sure with the people who already had concussions, and if they still had some imbalances when COVID affected your like mucous membranes, but you see your skin and your brain come from the same embryological tissue. So there's skin that's lining your lungs and there's skin that's lining your blood vessels, and it was attacking that embryological tissue line. So what happens, what I think is that for people who had the concussions, things got reflared because of this immunological response that then threw things out of balance. And what we've seen now, they're talking about post-concussive, or no, I'm sorry, post-COVID irritable bowel syndrome.
Mm,
So now the information's out there that you're having changes. So, like the International Journal of Molecular Science, they published and they said, hey, we're seeing multiple organ dysfunctions after COVID, and they're seeing neuropsychiatric, endocrine, gastrointestinal, musculoskeletal months afterward. And so you might start to see this more where they're calling it PACS. So it's post acute COVID-19 syndrome and things like that. But then now they're also talking about post COVID irritable bowel syndrome. So what's happening is that people are having gut brain axes as well. So when you look in the concussion world, and that's Stedman, he really likes to work on both the gut and the brain. And the idea is that if your brain has a problem, you can alter your autonomics, and that can change the health of your gut. Or if your gut has a problem and it gets inflamed, then your brain can get inflamed. And so there's this gut brain axis. Well, they're seeing it again. The thing is when stuff is true, stuff is true. And you can change the picture a little bit and you can change the principles a little bit, but they're really still the same. So what we're seeing with long haulers is they're getting gut problems and they're getting brain problems, they're getting cardiovascular problems, and they're becoming very, very chronic. So now, unfortunately, what's happening is as it evolved and it went from smell and taste to vestibular things to postural orthostatic tachycardic syndrome. But now they're finding they call it post-COVID POTS. So I don't know if everybody here is familiar with POTS. And again, I was very familiar with POTS because people get it after concussions. So POTS is postural orthostatic tachycardic syndrome. And after concussions, when people lie down and then they sit up, their heart rate can spike over 40 points. If it goes less, they might call it dysautonomia, but not POTS. If it goes to the required amount, then they call it POTS. Well, they published it that there's post-COVID POTS. So now there's this slew of post-COVID dysautonomia, post-COVID POTS, post-COVID irritable bowel syndrome, post-COVID tachycardic syndromes. And so people are impacted from it for sure.
Yeah. And we're pretty sure I had COVID January of 2020. So before it was like
Yeah.
known. And so I was the sickest I'd ever been. And then in May or June, whenever the testing came out, I did show trace evidence that I had it. And fast forward to July of 2020, I all of a sudden developed SVT, or supraventricular
Yeah.
tachycardia.
Yeah.
And AFib was a result of going into SVT.
Wow.
And so our best guess is it was from COVID. No way to know for sure. And at that time, things are still super unknown. But it was not enjoyable. I'm much better now. But it's really scary when your heart rate all of a sudden jumps to 200 and you're just sitting there watching TV.
Well,
So I'm
and the
curious
and
if
the
anyone else watching has had any sort of POTS or SVT or anything like that post COVID or post TBI.
So then the problem is when you had that, no one knew about it. So now, like the National Review of Cardiology in June of 2024, so just a minute ago, published the whole thing on cardiovascular autonomic dysfunctions. And what they talked about was people getting POTS and sinus tachycardia. So what happened there, it seems, is that it might affect your nervous system, which alters your heart rate and gives you POTS. But it also looks like it affected people's sinus tachycardia. And when it happened to you, no one knew about it, but it's published now. It's known. It's out there. And I think what's happening is there's a lot of people who are not realizing, you see, pathogens permeate societies. So when the Europeans first came over to the Americas, people got very sick. But now everybody's on cruise ships. They're all going around because we're sharing germs. So I think what's happening with this, and you could call it whatever you want, but this situation is that now everyone's sharing it. It's out there. Everybody probably has had COVID at this point. Maybe they got sick from it, maybe they didn't. But I think that it's impacting people, and it's impacting people in these really difficult ways to localize these mild dysautonomias or heart rate issues or balance problems or gut dysbiosis. Who's going to figure out they had gut dysbiosis from COVID? That's going to be
All
difficult
right.
to identify. But it's happening enough that the person's getting COVID, we know they got COVID, and then after that, they're having gut dysbiosis, that this information's being published in major locations, like Infectious Disease Journal published it on post-infectious disorders of gut-brain interaction after COVID. So it's coming out everywhere. It's known.
Yeah.
I guess in your book, we really published it maybe earlier than most people because
Yeah,
I did the COVID chapter in your TBI book.
yeah, in the concussion discussions, volume 2.
Yeah,
Yes, you talked about treating your post-COVID patients. Um, and, you know, I feel the funk neural world was more attuned to it. Like they knew right away, like, oh, we're going to be seeing problems from this. Um,
yeah,
and you were a little more vocal than perhaps, general practitioners about it. Um, and so Okay, so we've talked about some of the problems that have arisen from it and how it might affect TBI people a little more than, because we're a little more vulnerable, right? Like we already have issues going on. Some of us might already have POTS or dysautonomia or vertigo, whatever, inflammation
yeah.
going on.
And one of the big groups that I'm seeing, unfortunately, are young females with Ehlers-Danlos and autoimmune. And so, unfortunately,
Yeah.
and then those people are very susceptible to concussions anyway. So, like a young female with Ehlers-Danlos, she doesn't have that neck stability, and she becomes susceptible to concussions. And then Ehlers-Danlos can have cardiac problems. So, you're seeing a whole slew of teenage women um, with Ehlers-Danlos. They don't know they have Ehlers-Danlos, and a lot of them don't really realize that people with Ehlers-Danlos have auto, autoimmune problems, and then they're getting hit really, really hard. And again, for Katie, people with Hashimoto's, as you know, Hashimoto's is an autoimmune situation. And so then all of a sudden you fall into that. So Hashimoto's, hypothyroidism or euthyroidism, along with a TBI, people were getting POTS. Well, the same thing was happening to your group with COVID.
Yeah. Yeah. And so what are some things folks can do if they feel that they've been impacted and are having that lingering post COVID? What are some things they can do? What are some things you can help them with as a functional neurologist? All the good news.
Yeah, the good news, the good news is rough for me. Because I just saw one of the people in the chat, said, "Oh, talk about the gut dysbiosis more and things." And I used to do quite a bit of work in this area, and we'll have to talk about it because the good news is there are lifestyle changes that you can make that will help in relationship to the immune problems and the gut flare-ups. The bad news is that you have to make lifestyle changes, which people don't enjoy doing. And
Right.
so,
It's hard.
yeah. And so for me, I used to do a lot of biochem work. My wife did biochemistry since the 80s. And then as I shifted my neuro practice, I did more and more neuro and less of the other part. But once your immune system flares up, you have a little bit of a problem because you're now autoimmune. And what it looks like, and unfortunately, I just don't think we can get away from it, is that if you're autoimmune, you're becoming more sensitive to what's happening in this world. So I was talking to a lady the other day here in my office, and she's trying to understand what's happening for herself and her family. So her grandmother had autoimmune problems and her mother had autoimmune problems, but her autoimmune problems are worse. And so it's like, well, what's happening? And I don't think that we can pin it to one thing, but it's our environment is being taxed more. So
Yeah.
we became really smart and we decided that we knew how to mutate genes, and we started genetically modifying our food, but we don't understand the human genome yet. we understand very, very little about it. And it appears that changing the genetic makeup of our food very well may make people more sensitive. I don't know the exact numbers, but there are like anywhere from 60 to maybe several hundred chemicals that we use in America that are outlawed in other countries. I mean, you can't use them, you know, and so
And they're
we're
grandfathered in some of
yeah, yeah, and some of them got grandfathered in, and this whole thing now with the forever chemicals, the microplastic, it's like on your dental floss and all this. That's been out for a long time, and now they're trying to reduce them. But what they did was, instead of making the forever chemical 5 carbon atoms, they made it 3. And then they said, well, there's no research that says the 3 carbon atom one is a problem like the 5 carbon atom one was. And so we're being exposed to environmental toxins, genetic modifications. There's a lot of different things about electromagnetic frequencies. I don't think we have good research on that yet, but we do have good research on food allergens and things. So once your immune system becomes activated, you have to reduce allergens. You can run lab tests. You can find out which things you're more allergic to, but your big ones are dairy, gluten, soy, corn, things like that. And those are primary allergens, and people can become impacted uh, by these things. So if you reduce them, we're seeing people's inflammatory markers go down. Some of the inflammatory markers that you can watch are C-reactive protein, homocysteine, hemoglobin A1C, which is for your blood sugar. And what we see is that if people reduce these foods, then their immune responses improve. But unfortunately, we don't know how to cure it, and it's there. So you just
yeah.
have to learn to modify your environment with it. The other thing that you can do, exercise if you're capable of it, is very, very important. And then, of course, if it's impacting your brain, getting under somebody who knows how to heal a brain is incredibly important. And unfortunately, when we went through the decade of the brain, and I think we kind of came out with like luminosity or something, just doing these very simple brain games. There's a small group of doctors who really understand brain rehab, from what I could tell. And getting good brain rehab can get you back on track.
And I know for me, I I'd been told for years to go and try gluten free, and I resisted. I don't know why. Now that I am, it's like God, it wasn't even that hard. But it's been 3 years now this summer that I've been gluten free, and I just made the
Nice.
decision. And let me tell you, fog was within 2 weeks. I noticed the brain fog was gone. And then I could tell I wasn't as inflamed, lost a ring size because it was just
Wow.
inflammation in my fingers.
Wow.
Um, I the main tried it was because my IB, and it took longer, but eventually my IBS is now under control for the most part. On occasion that I choose to cheat, have something, sucker for Cane's strips, which have the gluten running on them, wheat. When I do cheat, I have an instant headache, I have brain fog, I have joint pain. So like I know gluten for me, right? And for other people, it might not be gluten. It might be, I mean, it can be so many things, right? It can be dairy, it can be like corn, right? Like do you put corn in? Brains?
Corn. Well, can you hear me?
Yes.
Oh, yeah, like high fructose corn syrup. It's
Yeah.
it's everywhere. We're
Yeah.
substituting it for sugar. So you're going, oh, and then, you're giving these people high fructose corn syrup, and that's going to have a huge impact, and it's going to affect their blood sugar regulation. And then when you affect your blood sugar regulation, you're going to affect your autonomics and all these things. It's a serious problem.
And so I know people don't like to change our lifestyle habits. Diet
Yeah.
is a main one. But I really encourage you, you can do anything for 30 days. And I feel like you have an idea if it's what you were eating, if you eliminate it for 30 days, I feel like it's a good length of time to know if it's having an impact. And by the time you get to 30 days, you're getting a new habit. So it gets easier and easier as you reach that 30-day, 90-day. But those elimination diets can be really beneficial to know what's affecting you, because it can be, I know I have a friend that found out, I think it's nightshades, right? Like peppers.
Yeah. Yeah.
Well, peppers and onions fall under nightshades. Um,
Yeah.
and
Peppers for
that was
sure.
hers. That
Yeah.
was her trigger. Um, so it can be really hard to figure out some.
Yeah. Yeah. And as somebody asked what some of the tests are, and one of the challenges, if we're looking at this from an immune perspective, is that you have some different immune cells. So that they might be called immunoglobulin A, immunoglobulin M, immunoglobulin G. So IgG, IgA, IgM. And these immunoglobulins are little cells that are going around in your body, and some are more in your saliva, some are more in your blood, some are more in other tissues. And they're looking at what type of toxins are coming into your world, and then they're reacting to them. So when you look at these tests, like one of the tests that people do is they scratch your skin with different chemicals, and then they watch which scratches react. But you see, that's not testing your gut. That's more testing this blood reaction in your
Yeah.
skin. So the one company I actually don't run them too much. I know it's Dr. Vajdani, but there's different companies, and they'll look at salivary immune factors, and then gut immune factors and things like that. And what they do with it is they then have to look at, say, this immunoglobulin A, and say it's in your saliva, but is it reacting to gluten? Is it reacting to dairy? Is it reacting to a nightshade? So you actually have to run not just a test for this one thing, but you have to look to see if it's reacting to different subsections. Then people will even look at it for different tissues in your body. And so it gets this huge list of things. But the best way to find out if you're reacting to something is just stop eating it for about 3 weeks and just reintroduce it. And if you feel bad, then you're reacting to it. But there are a ton of tests out there. But I don't think just going and say you could go to like any lab and get a blood test and run a blood test on your immune system. I don't think that's the way to go. I think it's better to go to somebody who really specializes in it. So like, I know, Amy, you work closely with Dr. Stedman, but there are thousands of doctors out there now. They tend to call themselves functional medicine doctors, or sometimes you have to be careful about using the word medicine. So some people, depending on their degree, are functional nutrition. And the idea is, and this is what's happening more and more in the world, is that when we have to look at function. So when we look at diseases, and in medicine, you have to remember in 1940 was when we proved there were cells called neurons. So it wasn't until 1940 that we got an electron microscope that we proved there were neurons. I think it was in the 60s when we found out about DNA. Let me just make sure. I always have a hard time with things like that.
Well, I know they didn't use it in forensics until practically like the 90s.
Yeah. So 50s, so the 50s we really did DNA. The 90s we start to feel that we're better with it. So what happens is as we're looking and we're saying, "Hey, what's this person have?" And they go, "Oh, well, they have a cardiac problem." But then later we went, "Well, but it's really a genetic cardiac problem or an environmental cardiac problem, or is it a cancer, or is it multiple sclerosis, right?" And so then when a pathology gets significant enough that we can really label it and identify it and repetitively identify it, then we can name it. And then we can try to create a treatment for it. And most of those treatments in this day and age are medications or surgeries. We spend trillions of dollars educating the public that they should do medications and surgeries. Quite frankly, we spend a lot of money telling people to avoid doing natural remedies. And actually, let me take a tangent because in the COVID world, I I stayed quiet on most all of it, especially being a chiropractor. It was a hostile environment. I think that we all really remember it wasn't safe really to talk about it. It wasn't safe to express your opinions about it. Uh, and if they were contrary to uh to the majority, to the majority that controlled all the media, you know. And if you spoke in a different way, it was a problem. So I was very quiet through the whole thing. I didn't really tell people much of what I did until till the rest of the world started talking about it. And when all the rest of the scientific journals started to talk about it, and they were talking about it, they set up rehab clinics where they were doing vestibular rehab for people with vertigo from POTS. So it was like, okay, now I feel more comfortable. I can speak about it. But my one big thing was, I'm driving down the road and there's signs in Atlanta, Georgia, which is where I'm at, that say, stay away from people and, wear a mask and wash your hands. And, everywhere I go, I go to the gas station and there's a sign telling me, stay away from people and wash your hands and all these things. You know, there was no education that said, hey, fruits, vegetables, exercise, sunlight, breathing, and movement are good for your immune system. And this would be a good time to try to build up your immune
Yeah.
system. There was no education that told people what to do. There was stuff. I was talking to a guy one day. I was doing a lecture. He was working the AV at the conference center, and he was in danger. He had diabetes and he was middle aged, so he was in an in danger group. That guy did not know that bread was really a sugar and that it wasn't so good for his immune system.
Yeah.
He
A lot of
did.
people
He
don't
didn't.
understand.
Yeah, he didn't have that education, and so I was like, okay, well, look, we're on break. Let me talk to you because you're worried about COVID, and you have bread and you have soda, and you're actually everything you're eating is a carbohydrate. So, so my big tangent on that was we could have spent a few $1 million educating people on how to be healthy, and so we have this on how to identify certain sicknesses, how to treat them, what the surgeries are, what the drugs are. But but quality of life is about functional application. What are you doing to be healthy on a daily basis? And I think if you really want to know how to monitor your own immune system and stay healthy, you want to find somebody who specializes in functional nutrition or functional medicine. Let them pick the tests for you, and then work to do the best you can. You also have to balance not focusing too much on it because there really is a lot of environmental toxins, and it's nice to
Yeah.
be anti-fragile, if you can be. But some people really, really can't. And then they just have to some people have to move and get better environments. So I hope that answered, AK. I hope that answered your question.
Yeah. And, it's so challenging. Who was writing about Amy, about how she's shocked at how little nutrition education have. And it's
Yeah.
very true. I brought up once that I had started gluten free, and so like it was just like, okay,
Yeah.
yeah, they don't get it. Um, you're not celiac. Why would you do that?
Right. No, what a great point. You're not celiac, but that's it. That's it. That's the exact point is celiac, you do a biopsy, you have this extreme allergen to gluten. It's a real problem. It endangers your life,
Yes,
but you can still be allergic to gluten and not be celiac, and it's
yes,
functional, you know? And more and more and more people are learning about it. The world's getting up to date on it, and there's more information on it now. It's becoming better understood. Um, and so we're trying to get it solved for sure. For sure.
hmm. And
So
do you feel? I mean, so do you feel people who have had COVID? How am I trying to word that? Had a mild food allergy and wasn't to them, and then they had COVID. Are you finding that post COVID has kind of like,
yeah.
and,
So I've
and
been I've been in practice. And by the way, am I breaking up? You're breaking up for me. You hear me
mm-mm,
really well though?
mhm.
Great. So I've been in practice about 30 years. And that gives me a fair amount of, oh, okay, AK, I see that. Uh yeah, it's a tough rabbit hole. By the way, I don't know exactly everything that Amy does, but I know that she provides resources for people. And so if you're in touch with her, she may be able to help you with that rabbit hole. I don't know if you do that, Amy, or
Yeah, like I have my doctor resource guide.
okay.
I'll drop that link down here.
Okay. So oh, bring me back on track. Oh yeah. So I've been in practice about 30 years and it's not the same. So I think before COVID there was a certain thing, and I think that after COVID people are harder to fix. I think that this last evolution, quite frankly, during COVID, I didn't have lots of problems. It was fine. But since people have been harder to fix. And I think it's what we're seeing here all over the place with the fact that COVID has impacted numerous systems: neurological, endocrine, vascular, cardiac. And now we're not hearing about it as dangerous as it was. I think that it's impacted society. I think that we're probably adapting to it, or it's mutated so that it's not as dangerous as it was, and hopefully stays that way. And but I think it's created quite a bit of a permanent impact on society, uh, and people like you said, who maybe used to have a little bit of an allergic response, they're having more. They used to maybe get, they eat something, they get sore, their gut feels achy. They're having more. And unfortunately, it looks like society is going to keep going further and further into frankenfoods, and so but it seems here to stay.
Yeah. So, Doctor, for anyone who, how can people get in touch with you
Yeah.
and how can they work with you? And I believe you offer a free phone consultation, correct?
Yeah, so the free phone consultation is really, we have patients come in from all around the world. And our patient base, unfortunately, has many of them have seen hundreds of doctors already. Realistically, that's real. But like seeing 20 or 50 doctors is just not, it's not a lot. And so the point of the phone consult is to be able to just talk to somebody and see if we're a good match for them. What it's not for is I'm not able to like give a person real advice, or I
Right.
give people advice on, I'll say, hey, if you're in this part of the country, you don't need to come see me. You could see somebody else. Um, I unfortunately don't refer to tons of people. Um, so the phone consults for that to see if they're a good match, or if we really believe we can help them before they go out of their way to travel, as
Right.
opposed to just getting advice. My website, which thanks for putting that up, um, it's there. You could take a look at it. We only talk about a few things of, we talk about helping people with concussions, vertigo, POTS, and migraines on the website, even though we do a lot more than that. Those are just the main areas where I just said, hey, let's just talk about this. We're just going to do these things, just a couple to point out for the public. But we have the website. The phone number is, I guess I can type it, 770-664. And we're in America. So that's the pound. Yeah, pound one. So that's our phone number and our website and things. And, we're happy to try to help. And then hopefully Amy's doctor guide is also helpful for people. I know that she knows a lot of great docs. So yeah.
Yeah.
Oh, can you also work with people who have trouble combating stress post TBI? Simple day of life is so hard to navigate. Yeah. You know, uh, Katie, hopefully I'm saying that well for you, is I got a website URL that I haven't used yet, but it's you'renotcrazy.com.
I love that.
Okay. Yeah. And I
You're
got
not
it
making it up.com should be the other one.
yeah. Yeah. And I got it because unfortunately, again, this idea, I don't have the right verbiage. Thank you. Thank you, Katie. I don't have the right verbiage yet of how to, I don't have the right verbiage of how to say this is a functional quality of life problem versus a gross pathology. But the whole thing is that people are falling into this quality of life problem, and people don't know how to help with it. And what happens is our emotional brain is under control of our higher brain. So when you're a child, you have more emotional outbursts and you have more issues. And then as your brain develops and you get more life experiences, you get better at controlling your emotional brain. Well, unfortunately, when people get a TBI, one of the things, there's a lot of things that can happen. But one of the things is if your frontal lobe has a hard time, then it doesn't control the emotional brain. And you can get emotional outbursts very, very easily, particularly, and Katie, I can see if you're typing in there. Do you happen to be real light and sound sensitive? So people who are light and sound sensitive, this middle part of their brain, we call it
Right.
the middle brainstem. It processes light and sound, and it processes um, emotional control, and people get emotional outburst. And yeah, okay. And so there's this variation in concussions that, in what I see, is a midbrain concussion. And when you have a midbrain concussion, you become super light and sound sensitive, and you can become explosive in your emotionality. And when you're done, you're going, well, wait a minute, I didn't even mean to be that way. And that can be this one thing. And unfortunately, then you it becomes real difficult because you want to go to dinner and the sound is driving you insane,
Yeah.
particularly if you have what we call sound maps and body maps. But like, if someone snaps their finger and your eyes are closed, if you can't touch it, if you miss, okay, your sound map is off. And when your sound map's off, you get a sensory mismatch. So you're looking at a person here, but you actually hear them over here, but you might not notice that. And it gives you anxiety. And so what happens, you just need somebody to fix that for you. And there are people out there who know how to fix it. There's two levels of it. So one level is you just can go onto YouTube and look at like vertigo treatments where they're like, look here, or turn your head like this, or go like this, and they help a lot. The only problem is that usually for people in your situation, you need an expert to do it, because you can't see your own. And when they're doing it the way that they do it, if you turn your head 120 times a minute, your inner ear is supposed to be able to sense that. So 120 head turns a minute, like that. If you go to 130, it's too fast. You actually can't feel it. And so what ends up happening is, a lot of times what they try to do is they try to get people to turn their head at this rate that is as fast as it can go. And unfortunately, people can't turn their head two times slowly. So what they do is they are, perfect practice makes perfect. And but when you practice it wrong, it's really bad. And so it's better to have an expert do it. And then
Yeah.
unfortunately, one of the things that I always talk about is we bridge a gap. So in medicine, you have the people who know the brain really well, like a neurosurgeon, and a neurosurgeon's just never going to sit there and do the treatment for you. They're not going to do it.
No.
They're not trained in it, actually. And there's a group, mostly chiropractors or chiropractic neurologists. So we're actually physicians, and we have medical training on blood analysis and salivary analysis, and how to check someone's heart, and how to check someone's nerves in their head and things like that. And then we do this additional training in brain rehab. But we're hands-on. Chiropractors are very hands-on people. So we're very natural to this level of care, where someone gets a concussion, they're having a hard time regulating their emotional brain. They feel like they're PTSD'd. And what we can go in and we can just do the gentle head turns nice and easy, get the movements correct, do the other things they need, and your brain can heal. It's designed to heal. It's just sometimes it needs help. They say with concussions, if it didn't heal within 2 weeks, then it'll heal in a month, 3 months, a year. If it hasn't healed in a year, then there's no hope. And that's horrible,
Yeah.
horrible. And I think, people go, oh, you shouldn't give someone false hope. I go, yeah, but you shouldn't give people false despair, and tell them that they just have to get used to this for the rest of their life, and that if they could just relax, they'd feel better. It's madness. It's
Yeah.
crazy. And they put them on antidepressants, and just tell them to just go through life. Put them on
You're just
anticonvulsant
depressed.
medication. Yeah. They're what?
You're just depressed.
Yeah. Yeah, it's so sad. But there is help. The PTSD thing that you're mentioning is definitely, it sounds like you have this certain variant and that can get better and you might not be PTSD'd. So,
Yeah. Yeah, and for me, I sound sensitivity was probably my longest lingering symptom. And like going out to eat, like you said, was so hard. Or in a group of people that are talking and I just couldn't track anything. Um, but that's all better now. And so I just want you to know that there's hope. No matter, and I was probably 7 years out at that point when I finally got over the sound sensitivity. Um, and so there's hope. And doctors like Dr. Ellis know how to help us. And that's what I'm here for, is to try and help you guys get some answers and help you find the right clinician to help you. Um, so when I send out this replay to everyone, I'm going to make sure I include Dr. Ellis's info, and I'm going to send you all a form to fill out if you would like his clinic to call you. Um, to answer any questions you might have about working with him. I will have that out in that email as well. So watch for that. It'll probably go out sometime tomorrow. It usually takes me a day to get it all put together for you guys. But thank you all for being here. I hope this has been helpful for you. Let me know if you want me to do more of these types of TBI talks. I'm always happy to get these lined up. Thank you, Dr. Ellis, for being here. Do you have any final thoughts for our listeners,
well,
viewers?
again, for Katie, it's very clear in your posts that you're the classic TBI person. And the last thing you said is so incredibly true. And it's hard for the family to understand it.
Yeah.
And the person who went through it doesn't have the language to even explain it. They can't say, hey, I really am having this. And then the doctors tell them that they're just stressed because they look fine. Great. It's one of the, it's actually one of the worst things. You have a concussion patient come in and you go, you look great. And they just get sad right away. They're like, don't tell me that, because it's not how I'm feeling inside. And I need somebody to see inside to understand what's happening to me, and then their family needs to understand it so they can support them. And you must have had the concussion because you have the story. Um, realistically, maybe Amy should interview you, because unfortunately, it sounds like you're going through the post-concussive story. So we could talk, Katie. I'll try to give you a call, and maybe if you're not near me, maybe we have somebody close by for you, who can help. But that was it. I appreciate everyone, and hopefully we get this post-COVID thing going. And if you do have a post-COVID syndrome, I know we talked about a lot of concussions, but there's help. There is help. You got to get your nervous system rewired and then try to get your immune system doing as good as possible. And your body can improve for sure.
Yeah. Yeah. Well, thank you, Dr. Ellis, so much for being here. Thank you, everybody, for joining us. I hope that you found this helpful and useful. And again, watch for that replay that'll come out tomorrow, and it'll have a bunch of links in there for you. So we hope that we can get you on the right path to feeling better, whether you're post TBI, post COVID, or both. So thank you all so much for being here.
Okie dokie.